Hi, I'm Dr. D, and today we are going to talk about essential topic, sleep. We all know that sleep is crucial, but did you know that insomnia can make it hard to control your blood pressure, make you more susceptible to infections, and even shorten your lifespan? Insomnia has been linked to increased risk of cardiovascular diseases, including hypertension, heart disease, and stroke. Poor sleep can increase blood pressure and heart rate, making it harder to control your blood pressure even with medication. Snoring at night, which can be a sign of obstructive sleep apnea, can also make controlling your blood pressure almost impossible. Lack of sleep can also weaken the immune system, making us more susceptible to infections and various illnesses, including cancers. Chronic insomnia has been linked to increased inflammation in the body, which can contribute to a range of health problems. People with chronic insomnia have higher levels of inflammatory markers in their blood, such as C-reactive protein and interleukin-6, compared to people who get adequate sleep. Insomnia disrupts the body's normal regulation of stress response, which can lead to increased inflammation. Lack of sleep can activate the sympathetic nervous system, the body's fight and flight response, and the hypothalamic pituitary adrenal axis, both of which are involved in the body's stress response regulation. Chronic activation of these systems can lead to increased production of stress hormones such as cortisol and increased production of inflammatory markers. Moreover, poor sleeping patterns can also shorten your lifespan. A recent study found that about 8% of deaths from any cause could be attributed to poor sleep patterns. Individuals who had 5 low-risk sleep factors were less likely to die from cardiovascular disease, cancer, and other causes. In fact, men who reported having all 5 of the quality sleep measures had a life expectancy that was 4.7 years greater compared to those who had none or who only had 1. Women with a good sleeping pattern had a life expectancy that was 2.4 years greater. If you do have problems with your sleep, it is essential to talk about it with your healthcare provider. Insomnia is usually a symptom of other more severe disease that could have serious consequences down the road. Thank you for joining me in this important topic on sleep. Be sure to join us in our next video for more health tips to help you live a healthier and longer life.